Welcome to PYQ series 2025. So today we'll be discussing about the new topic, human diseases and their control. So dear students, in this topic they have discussed many more diseases here, communicable, non-communicable. Okay, if you are doing mind map for this classification of the diseases, for example, you will give at least five examples for each and every type of disease here. Okay, and you will be remembering the disease like what is the mode of transmission, then incubation period, pathogenicity, then you will discuss about the symptoms, then you will discuss about the diagnosis, and after diagnosis, treatment and prophylaxis, right? So this is what the correct sequence, how you will remember all the diseases here. And besides that, if you are going to prepare the mind map, it will be the best navigator for all of you. Okay, so let us start here for the human health and diseases. Got it? So let us see the first question here. What is the first question? Read the statement. A foreign substance invading the body and capable of stimulating the immune response is. Let us see what are the options here. Antibody, antibiotic, antigen and anticoagulant. So dear students, the answer is very simple, and that is nothing but what here? Antigen. You know that antigen is a foreign particle which will stimulate the production of what here? Antibodies in your body, right? So this is what the ideal answer here you have, that is antibody. Okay, so remember A is the correct option. Now question number 2, coating of bacteria which will facilitate the phagocytosis is dash. So options are agglutination, then opsonization, then neutralization, and next is immunization. So dear students, you should know all the names and all the examples and their meaning. You know the meanings of all the examples. You know agglutination reaction, you know that antigen antibody reactions will be there. Opsonization, there will be coating of the pathogen along with some special proteins here. Then neutralization reaction, you know, antigen antibody. Immunization, you know that giving the vaccination and getting the protection from the diseases here. So your answer here, whenever you have the pathogen here, okay, the pathogen is coated with the very special proteins so that they can have the action of what here? Antibodies, and they can have the good immune response. So what should be your answer? Your answer is opsonization. Then the phagocytic process will be very easy. Got it? So B is the correct option. Next, semen contains dash and dash that have the antibacterial properties. Okay, so what are the options given here? Prostaglandins and calcium. Number 2, spermine and zinc. Next is bicarbonates and fructose, fatty acids and magnesium. So you have the correct answer here is B, spermine and zinc. That will give you the what here? Antibacterial properties for the semen. Okay, next question. Helper T cells carry out the following functions when sensitized against the pathogen. Let us see what are the options. Number 1 is proliferation of the T cells here, stimulation of the macrophages, then stimulation of the B lymphocytes, and secretion of the perforins, right? So what should be your answer? Your answer here is secretion of the perforins. Okay, these are the very special proteins here which are going to be very helpful in the immunological reactions for the defense mechanism. Next, transfer of antibodies from mother to the infant through the colostrum after birth provides dash to the baby. Okay, so you know that whenever mother, okay, mother's first milk after the delivery, she will have the secretion of what here? Colostrum. Colostrum is the mother's first milk, which is a clear and a very sticky substance over here, and that is giving you what here? Highest concentration of antibodies here. Got it? And these antibodies are giving the protection here to the fetus, and the child is getting good immune response, and the child will have good what you can say resistance power due to the intake of what here colostrum. So what should be your answer? This is giving you the natural acquired passive immunity. Direct antibodies are given to the fetus. So this will be the passive immune response. Okay, this will be the natural one. Mother is giving the natural protection to the baby. Okay, so it is the correct option. Next, administration of BCG and polio vaccines provides dash. Number 1, natural acquired passive immunity. Number 2, artificial acquired passive immunity, natural acquired passive active immunity, and artificial acquired active immunity. So D is the correct answer here. BCG and polio vaccination. You know that what is the definition of vaccine? You know that vaccine is, okay, vaccine is the live. Okay, definition. Students, please note down the definition of vaccine. Very simple. Live or attenuated form, live or attenuated form of the pathogen is nothing but what here? Vaccine, right? So your correct answer here is artificial acquired active immunity. This is. Got it? Next. Interferons, a class of cytokinins that are released by the certain white blood cells to stimulate the other cells and to protect themselves from the infection caused by dash. Okay, so you know that this is caused by the virus. You know that B is the correct virus. You know that interferons, right? Interferons are the very special secretions against the viral infection. Got it? And they are released here in the defense mechanism. This is the very important thing for the immunity, right? So please students remember the word interferons, right? Okay, so what is the next question? Cells with process of antigens present on them on their own surface to activate the helper T cells are antigen presenting cells, natural killer cells, then we have hemocytoblast, and we have parietal cells here. So what should be your answer? Antigens that present on their own surface, these are antibody presenting cells, which is also called as APC. APC is what here? Antigen presenting cells. Got it? So these are the things here to remember. So A is the correct option. Next, question number 9. Select the correct match. Okay, read the statement very perfectly, all the statements, and choose the correct example here. Okay, see here, what is statement number 1? Statement number 1 is natural acquired immunity antibodies obtained from the hyperimmunized horses are injected into human beings against the rabies. Got it? Number 2, artificial acquired immunity developed after the attack of what here? Measles, right? Then artificial acquired active immunity, non-specific immune response to such as cough reflex, presence of saliva in the mouth cavity, and natural acquired passive immunity, that is acquired by the infant from the mother by the consumption of what here? Colostrum. So this is the correct answer, because you know that whenever mother is giving the colostrum to the baby, right, that will be the passive immune response. That is, direct antibodies are given to the fetus and fetus is getting the best protection. Got it? So which should be the correct answer here? D is the correct answer. Okay, so students, please note down this answer very perfectly. Next, question number 10. See here, hemocytoblast seen are stem cells which give rise to the lymphocytes found in the fetus and in dash of the adult. So where will be the things here? These cells will be present here in the liver and bone marrow. Where will be the cells here? Those will be in the liver and bone marrow. Please note down the answer. Okay, B is the correct answer, that hemocytoblast are stem cells which give rise to lymphocytes found in the fetus in liver as well as bone marrow. Please note down this answer very perfectly. Got it? Next, Question number 11. Select the incorrect statement. Okay, let us read what are the different statements here. Then only you can choose the incorrect amongst it. Okay, number 1. Hemocytoblasts are seen in the liver of the fetus. In an adult person, the hemocytoblasts are found in bone marrow, which produce lymphocytes here. Tonsils and pear patches are the bursal lymphoid tissues. Then next is bursal lymphoid tissues are the places for differentiation of what here? T cells. So what should be your correct answer? Your answer here is D. Okay, D is supposed to be the incorrect statement, but it is your correct answer, right? So this is what the incorrect one, which is your correct answer. Okay, remember this. Next. Question number 12. Following types of barriers in the innate immunity. You know that we have got the two types of immunities here. Innate immunity, which is natural, and we have the acquired immunity, which is gained after the birth here, right? So what is given in the question? The question is giving you the barriers about the immunity except. So arthat, active phase proteins of plasma, natural killer cells, C is spermine and zinc in the semen, and BCG vaccine. Straight away, your answer here is, correct answer is BCG, okay, which will not be acting as a barrier for your immunity. So this is the correct answer. Next. The antigen binding site on the molecule of the antibody is formed by dash. What is that? Both heavy chains, one heavy chain and two light chains, then variable regions of each chain, that is light and heavy chain. Okay, and we have here that is variable region of light and constant region of the heavy chain. So students, for this purpose you should know what are the antibodies here and how they have got the structure. So I am drawing here the view so that you will remember the structure very perfectly. Got it? So here is the antibody. So antibody, this is going to be what here? Heavy chain. Got it? What is this here? This is heavy chain. And this is what here? This is light chain. Got it? And you have got the very special regions here. So these are the regions of what here? This will be the regions of variable regions from both the sides. Got it? So this will be the region. Okay, this will be the variable region. You know that this region is nothing but what here? Variable region. Okay, this will be variable region. And this will be what here? Constant region. Okay, you should know the difference between variable region and constant region. And where will be the antigen binding site? So antigen binding site will be here. Got it? This will be the antigen, and antigen is captured here like this. Got it? So this is how the reaction is going to be there. So what should be your answer? Antigen binding site, variable regions of each, that is light chain and heavy chain. So this will be the variable region of what here? This will be the variable region, this much. Okay, so which is the correct answer here? C is the correct answer. Note down. Okay, note down in your notebook that this will be the correct answer. Please mention all the chains here. You can see the variable region, constant region, and variable region is giving you the antigen binding site here. You know that antigen has got epitope on the surface, and this has got the surface which is called as what here? Paratope. Okay, paratope is present here. Got it? And antigen is having which part here? Epitope. Antigen has got epitope and this has got what here? Paratope. So please note down these two things here very perfectly. I'm giving you 1 minute for this so that you will remember, or if you are having your notebook in front of you, and you should have your notebook whenever you are watching this episode for your PYQs, You should remember that exactly what are the points here and what are the highlighting points over here. Okay. So students, what is there on the antibody? Paratope. What is there on the antigen? Epitope. And which portion is giving you the reaction here? That is variable site of light chain and variable site of what here? Heavy chain. Got it? So this is your answer. Read the question carefully. Question number 14. That is Duffy, Kidd and Lewis are the names of blood group system, antibody producing cells, scientists associated with the immune system, and names of the vaccines. So students, A is the correct option. Note down, A is the right answer for this question. Next question, you are supposed to see what is P, what is Q and what is R. You are supposed to find out. This question is related with the genotype of the blood group. This question is giving you antigens on the surface of RBCs of that particular blood group and the antibody in the serum. Got it? So let us see what is that. Okay, we have here, that is question number 15. You know that here for AB we should have here, what should be your answer? IA, IB. Got it? And here there will be nothing in there, nothing on the surface of what here? This one. And what should be there here in the R? R will give you the antibody for B. Okay. So what should be your answer? Your answer here is this. Okay. So these are the things here to remember. Next. If Rh antigen introduced into the Rh negative person for second time, then leads into, very simple, amoebiasis, ascariasis, filariasis and erythroblastosis. What they are asking here. Okay, you should know. Okay, see here what are the things. If mother is Rh negative, okay, and if father is Rh positive. Students, you know Rh positive is a dominant character. So what will be the blood group of their child? Obviously child is going to be what here? This will be the first pregnancy. Okay, during the first pregnancy the child will be Rh positive obviously, but you know that this mother during this pregnancy she will have the production of what here? Antibodies. She will produce the antibodies here against this one. Got it? Against the Rh positive. But during this one she will have the normal delivery. Got it? There will be what your normal delivery. And what will happen during the second pregnancy? Okay, second pregnancy will give you what here? During second pregnancy, again the child will be what here? Rh positive. Okay, and already she will have the antibodies against this. So what will happen here? RBCs of this child, okay, RBCs of this child are attacked by means of what here? Antibodies. And there will be what here? Erythroblastosis. Erythroblastosis. Got it? There will be destruction of the RBCs and there will be miscarriage. There will be abortion. So the second pregnancy, second child is aborted here. Got it? So this is what happens in case of what? If the mother is Rh negative. Okay. So what is this disorder called? This disorder is called as erythroblastosis. What is this disorder here? Erythroblastosis fetalis. This is the name of the disorder. Erythroblastosis fetalis. Please note down. So what should be your answer here? Your answer is erythroblastosis. But you know, students, nowadays there is no any harm during this, because you know that once the doctor knows ki this mother is RH negative, so mother has been administered here with the antibody injections. Okay, antibody injections are given here to the mother, so that she will have the nullifying effect for this antibodies, and there won't be any adverse effect during the second pregnancy. She will have normal pregnancy, there will be normal delivery, the child will be normal, there won't be any miscarriage here. Okay, so this is your answer. Next question. What would be the possible genotypes of the parents if the blood group of the offsprings is O? Okay, so you should know the perfect answer here. If you know the genotype perfectly, then it is very easy to give the answer. IA and IAIO. This is the genotype for the A blood group. B blood group will have what here? IB, pure homozygous, okay? And there will be IBIO. Then for AB blood group, the genotype is IAIB. This is the ideal example of codominance, right? And for O blood group, you know that O blood group is a pure recessive character. So what they are asking us, what would be the possible genotypes of the parents whenever the blood group of the offspring is O? So when will be this condition? Whenever the parents will be heterozygous for O. Okay, so means what should be the possible combinations here? So this is your correct answer. Either this will be the condition, this will be the condition, or there will be the condition here like this. 1, 2, 3. So these are the possible chances here. So what should be your correct answer? Your correct answer here is C. And you should know the perfect. This will be the perfect genotype, you should remember, and you should be able to have the proper this thing here for the inheritance of the blood group, right? So this will be the ideal thing. Note down this. What will be the possible blood group of what here? Offsprings. O blood group. For O blood group, you should know all the things very perfectly. Got it? Please note down the things here. Note down all the things very perfectly. Now question number 18. Rohit has A blood group that indicates what? Presence of A antigen on the surface of RBCs. Presence of antigen A in the plasma. A antibodies on the surface of WBCs, no question. A antibodies in the serum. So what do you think here? What is the answer for this? Obviously, presence of the antigen A on the surface of what here? RBCs. This will be antigen A. Got it? So what should be your correct answer? Your correct answer is here this. What will be for B? B will have the B antigen. So this will be antigen B, okay, on the RBCs. Should know. Okay. So this will be the correct answer. Then question number 19. To prevent the erythroblastosis fetalis. Just now I explained you the erythroblastosis fetalis, right? So Rh negative mother can be treated with what during the pregnancy of when she has got the Rh positive fetus? So of course she should have the injections of anti-Rh antibody. Okay, this mother, she should have the injections of what here? That is anti-Rh antibody. Got it? So please note down this. Okay, D is the correct answer. Very, very simple. Question number 20. Okay, see here. Which of the following have V oncogenes? You know that oncogenes. What are oncogenes? You know that oncogenes are the genes which are responsible for the production of tumor. Means what here? For the production of what here? Cancer. So you know that there are some viruses which will induce the gene, which will transcribe the gene, and there will be production of what here? Tumor. So what are those here? So you have this number one, that is Epstein-Barr virus, and you have human papilloma virus. You know that these two viruses, they are responsible for the expression of the oncogenes, right? So these are giving you the production of what here? Tumor. And you know that HPV, this is giving you the production of what here? Cervix cancer. Cervix cancer in female. Got it? So students, please note down this. Okay, these two are the viruses which can be responsible here, which are responsible for the production of what here? Tumor. And you know that HPV, we have many more cases. According to WHO report, we have in India many more women, they are responsible for the which cancer here? Cervix cancer, due to HPV infection. Next, question number 21. Subcutaneous filariasis is caused by Plasmodium vivax. See the options: Loa loa, Ascaris lumbricoides, and Entamoeba histolytica. You should know. So your answer is Loa loa. Plasmodium vivax, you know, malarial parasite. Then we have Ascaris lumbricoides, responsible for ascariasis, and Entamoeba histolytica. This will give you the expression of the disease, and that is nothing but what here? Amoebiasis. Okay, so you should know all the answers very perfectly. Now the next is transmission of the malaria is through. So fecal-oral route of transmission, vector, transplacental, or airborne. So you should know malaria. Malaria is a vector-borne disease here, and you know that this is there due to the bite of what here? Mosquito. Which mosquito? There will be the female mosquito which is responsible here. Anopheles female mosquito. Okay, so B is the correct answer. Next, question number 23. Which one of the following diseases is called as modern pandemic? You know that how many types of diseases we have? You can classify the diseases here. Number one, according to the spread of the disease, that is endemic diseases. Endemic means what? The spread of the disease is related only one with group. Ideal example you can give, and that is nothing but common cold, right? Number two, we have got epidemics. You know that epidemics means what? Sathi se azar, like what? Conjunctivitis, cholera, typhoid, malaria. So these are the ideal examples of what here? Epidemic diseases. And next is what here? Pandemic. You know that pandemic is the spread of the diseases worldwide, as we have been since 2020 to 25 up to 2 to 3 years, we have experienced the COVID-19. So it's a pandemic infection, right? So we have the modern pandemic is AIDS. You know that AIDS infection is a pandemic infection. Means what? The disease is going to be there worldwide. Throughout the world, you can check out the patients, right? Next, select the correct match of the species of Plasmodium with respect to their incubation period. You know that we have got the different species of the Plasmodium vivax. That is Plasmodium malariae, Plasmodium ovale, Plasmodium falciparum, and Plasmodium vivax. So amongst these, we are supposed to check out the correct option here. So we have the correct option here, and that is Plasmodium ovale, which gives you the incubation period of 17 days and with high fevers after 48 hours of intervals, right? So here B is the correct option. Next, question number 25. Which one of the following disease does not transmitted through the fecal-oral route of transmission? What is the meaning of fecal-oral route of transmission? If the drinking water is getting polluted with the fecal matter, and if you are going to drink such kind of water here, that transmission will be what here? Fecal-oral route of transmission. So which disease is there? Number one is pneumonia, number two is ascariasis, number three is typhoid, and number four is amoebiasis. So you should know which is not they are asking you. So of course pneumonia, because pneumonia is a airborne infection, right? So you know that this is the correct answer here. Got it? Because rest of these, they are showing you the fecal-oral route of transmission. Next, Match the following. Next is match the following here. Column 1 and column 2. So osteosarcoma, adenosarcoma, leucosarcoma and myosarcoma. So what are the tumors here? So we are supposed to find out the correct answer. Number 1, osteocarcinoma is a cancer of bone. Okay, adenocarcinoma, it's a cancer of what here? This will be the cancer of this adrenal gland. Liposarcoma, cancer of adipose tissue, and this will be the cancer of muscle. Okay, so what should be your correct answer? Your correct answer is B. Please note down the change here, match the followings, right? Note down the things. So students, are you getting here that this will be the correct answer? Correct answer is B. Let us see the next question. Again, match the following. They have given the disease, the causative agent and the symptoms, right? So malaria, causative agents they have given. So we are supposed to choose the correct group here. Which is the correct group? Elephantiasis, ovale, plasmodium, no. Amoebiasis, Bugardia malea, and arthralgia and anemia. So let us see what is the correct answer. Your correct answer here is number 1. That is 1 is 2 and this one and this one, right? So malaria we are supposed to see Plasmodium ovale, okay, and that will give you the here this one, right? Next is second is elephantiasis. So it is the answer here, and symptoms are enlargement of lymph nodes, right? And 3 is amoebiasis and Amoeba histolytica, and it will give you what here? Diarrhea and flatulence. So students, please note down this chart very perfectly. C is the correct answer. Okay, here remember C will be the correct answer. Choose the correct alternative and note down all the things here. Again, I am repeating this because you should know what are the symptoms and what are the causative agent. Malaria, Plasmodium ovale. What are the symptoms here? Arthralgia and anemia. Elephantiasis. What is the pathogen here? Bugardia malea, and symptoms are enlargement of the lymph vessels and lymph nodes. You know elephantiasis, right? And amoebiasis. The pathogen is Amoeba histolytica, and ideal example you are getting here is diarrhea and flatulence, right? So what should be your correct answer? I told you correct answer is C. C is the correct answer. Let us go for the next question. Which one of the following is not symptom of typhoid? You know that typhoid is the disease which is foodborne infection. It may be the waterborne infection as well, and the pathogen is Salmonella typhi. You know this very well. And causative agent which is not, they are asking us that what is not the symptom here. So the correct answer, let us find out. Red rose patches, yes, they are accumulation of the lymph tissue causing oedema, white coat of the tongue, and anorexia, loss of appetite. So your correct answer here is this. This cannot be the symptom of what here? This typhoid. Rest of these are. Okay. Next. Which one of the following is not type of sarcoma? Bone tumor, cancer of cartilage, muscle tumors, and cancer of lymph nodes, right? So what should be your answer? So D is the correct answer here, not the type of sarcoma. Next. Column 1 and column 2. Column 1 is giving you the symptoms, and column 2 is giving you the correct match we are supposed to give here. That is for 30, we have anorexia, that is nothing but loss of appetite. I'm sorry. Dysphonia, that is shortness in the breath. Okay. Eosinophilia, that is what here? Abnormally more this one eosinophils. And arthralgia, that is the joint pain. Okay, so what should be your correct answer? Your correct answer here is A, right? A is the correct answer. Note down. You can watch both the columns very perfectly, minutely, and with concentration. Okay, so you should know the answer very perfectly. Next, the microphilia, that is Vidyarjan bancrofti. You know that Vidyarjan bancrofti, it is the pathogen for elephantiasis. Okay, undergo molting 2 times. Now students, please remember the cycle. There is a complete cycle given. Very nice picture is given here in your notebook. I'm sorry, in your textbook. So please go through that. So what they are asking us, that the microfilariae Vidyarjan bancrofti undergoes molting 2 times in. So in which region they are giving you this one? So which one here? That is Culex mosquito. In the mosquito body, they will give you the molting 2 times, right? So you should know the pathogen. Question number 32. Which one of the following actions helps in the transmission of HIV? You know that HIV is categorized as STD, sexually transmitted disease here, okay, which is AIDS, acquired immunodeficiency syndrome. Okay, so what they are asking us, which one is the action helps in the transmission of HIV? Insect bite, blood transfusion, casual handshake, and sharing the clothes. So AIDS is not going to be spread here in our society by casual contact. So obviously via blood transfusion. You should know all the modes of the blood transfusion. According to WHO report, they have given the percentage of the transfusion here. So we know how this sexually transmitted disease. What are the rest of the media which will give you the transmission of AIDS? That is nothing but what here, homosexuality. Got it? Then unhygienic sex. Okay, unhygienic sex. Then we have another is what here, contaminated needles and syringes, contaminated needles and syringes, right? Okay, then from infected mother to the fetus, from infected mother, okay, to the fetus, right? Okay, so there are many more medias due to which you may have the transmission of the HIV in this society, which is going to be the biggest problem, right? You know that nowadays India is becoming a cradle of this HIV infection. Got it? Next, which one of the following is not caused by the fungus? Then onychomycosis, then athlete foot, then dermatophytosis and elephantiasis. Which is not caused by the fungus is obviously elephantiasis, because elephantiasis is a vector-borne infection. You know that it's a parasitic infection, it's a vector-borne infection. It cannot be a fungal infection here, right? So your answer is elephantiasis. Next, which one of the following species is causing the serious fatal malaria? Okay, so fatal means what? Lethal. What is the meaning of fatal? Lethal. Lethal is what here? Harmful. The most harmful is what here? Lethal. Please note down. So what should be your correct answer? Plasmodium falciparum. This is supposed to be the dangerous infection amongst the all, which is supposed to be dangerous, Plasmodium falciparum. Next, the larvae of Ascaris passing through the various organs of the human body settle in the dash stage of this one: lungs, kidney, lymphatic system, and digestive system. Of course, the Ascaris is related with what here? Ascaris lumbricoides. Ascariasis, that is, you know that Ascaris lumbricoides. Got it? So this is what the pathogen which is getting attached with this one, right? Then the next one, lymphedema and accumulation of the lymph fluid tissue causing this swelling is seen in. So what should be your correct answer here? That is amoebiasis, filariasis, malariasis, and ascariasis. So of course it is observed in ascariasis. Remember the answer. Next, In which of the following country AIDS was detected first? AIDS was detected first in America. You know that Hatai. Got it? That was the place where you are getting the first patient. And where in India? In India, it was there in South India. Okay, Chennai. First patient was recorded in Chennai. Excessive doses dash causes the extreme happiness, irritability, panorrhea, and that is nothing but what here? Cocaine. So for this, every drug you should know the mode of action. Okay, so you have the cocaine here. Next, an alkaloid which increases the level of neurotransmitter, that is dopamine, which is obtained by erythroxylum coca. Okay, students, please remember the chart, do the mind map for the all types of drugs, their mode of action and the bad effects. Okay, all these things you should do the chart of this as a mind map. Side effects and misuse of the anabolic, that is steroids in males, are as follows: kidney and liver dysfunction, enlargement of prostate gland, premature baldness and acne, decreased sperm production, excessive hair growth on face, body, and enlargement of what here? Clitoris. So what do you think here? So D is the correct answer. Misuse of anabolic steroids here, right? So this is the correct answer. Next, morphine, a pain reliever and the cough suppressant alkaloid, is obtained from, that is Nicotiana tabacum, Papaverum somniferum, Hibiscus cannabinus, and Zmeys. So what should be your correct answer? Your correct answer is Papaverum somniferum. Got it? So all these are the very, very important questions which we have discussed here from the disease and health and disease here. Okay, this topic. Students, this topic, that is human health and disease, this is very important for all of you, and it will be very easy to remember if you are going to prepare the charts, if you are going to at least collect the five examples of each type of disease, and if you are going to prepare the chart of the type of that pathogen, then mode of transmission, then incubation period, then next is pathogenicity, then the symptoms, after that diagnosis, then after that treatment and prophylaxis, that is preventive measures. So if you are going to prepare this chart, this mind map, it will be the best navigator for all of you. Okay, and if you have got any doubt, you can do the comment, you can release your comment here. Okay, so thank you, all the best for this topic.